Greeting Tufts University School of Dental Medicine colleagues. It has been a few weeks since I gave my last video update. My, how our world has changed in the last 3 weeks. I sit here in Merit Auditorium where countless generations of Tufts students have spent many an hour absorbing facts and figures. Countless hours spent learning about clinical techniques and gathering pearls of wisdom from our beloved faculty. In fact, when I listen to alumni, it's the faculty that many of them remember the most. Patient stories and staff that have helped them are also mentioned. And it's not only the faculty that lecture here in Merit or in the preclinical areas, it's the faculty that are their clinical teachers and clinical mentors. Students and alumni mention the amazing teaching skills and clinical skills that the faculty have. But foremost, they mention the care, the connections, that special feeling of being a part of the Tufts dental family. Over and over again, I've heard about our family, the Tufts dental family. Many of you, especially our faculty and staff and alumni, are hunkered down right now with your families. Some of our students and residents, unfortunately, are unable to be with their families. I know how difficult it is for you to be away from your loved ones at this time. Some of you have family scattered across the country. Others have family from overseas. I know your loved ones are also worried about you. That personal touch represented so well here at TUSDM, that personal mentorship that so many have cherished over the years, is gone for now. Instead, we are quarantined, we are distanced, and as of this moment, we are masked. As I walk from the garage to TUSDM every morning, I am reminded of the sacrifices that we all are making to help our colleagues in the hospitals, for the public health of our communities, and for the public health of the country. It starts from the garage where I put on my mask as I walk to 1 Neelan Street. It extends to Tufts Medical Center where access is restricted to one entrance. As I walk by the hospital, I see signs on the pavement thanking our medical colleagues, the doctors, the nurses, and the staff who are on the front lines of this pandemic. I see hearts and a large sign on windows at the hospital. One sign says, "Not all heroes wear capes." And I see another sign screaming, "Boston Strong." At TUSDM, we have also restricted our entry. You can only get into the building through the entryway into our new lobby. As I enter TUSDM, I am greeted by staff and students who are masked and gowned, who screen me, both asking me pertinent questions and taking my temperature. They give masks to all who don't have them. Sean from the police department is a welcome face every morning, despite his black mask. This is also the greeting our emergency patients receive before they head up to the second floor. Our emergency team of faculty, staff, residents, and students take care of patients under the steady guidance and leadership of Drs. McGarry, Papa George, Amato, and others in our clinical leadership team. You can sense the relief that these patients feel as they are welcomed into our lobby. It is also reflected in the notes of gratitude that we receive. It meant everything to a patient who drove all the way from Tennessee to receive care. I thank our providers and staff for this limited clinical service that we are able to provide. The goodwill continues through many at the school and to many of our alumni who have gathered personal protective equipment and donated it to the hospitals. I would like to talk briefly about the phases we've been through and what a resumption of services might look like. I have identified 2 major phases that we have been through and one that we are preparing for. In phase one, we had to shut down and ramp down our educational, clinical, and research programs. We shifted to online classes for dental students and our residents, and we started our emergency clinical operation. All staff, for the most part, started working remotely. All of this was a huge task and a great team effort at the dental school and at the university level. In phase two, we have fine-tuned our emergencies through a phone triage system, and we have piloted a telehealth program. Our faculty and staff continue operations remotely, supporting our educational, research, enrollment, and small clinical services. Our students, faculty, and staff are all located off-site, except for those that are providing essential services. Our seniors are anxious to graduate, our D3s want to be back in practice, and our D1s and D2s continue to learn online, but wonder what this hiatus means to them. Our residents have similar concerns. The university and school have started to turn their energies towards financial continuity. In phase three, we are all thinking about the flattening of the curve. Our attention at TUSDM turns to resumption of services, recognizing that it will be a slow return to all services. Our leadership teams of faculty, staff, and students are considering what a clinical start date might look like, when we can get students into our preclinical spaces, when we might be able to get staff back in the building, and when we can restart our research enterprise. A lot is predicated on state and national guidelines, on new clinical protocols, and on the supplies needed for personal protection. Throughout each phase, I remain inspired by our faculty, students, residents, and staff. We all remain jumbo strong. We all remain Boston strong.